A pandemic is upon us. Coronavirus is forcing everyone to stay locked up inside their houses, make bad quality explainer videos from home, and feel good about themselves for doing it. Okay, maybe that's just me. But hey, you locked up people have been asking questions like, how is India doing when it comes to fighting coronavirus? Are we good? Is Modi's plan effective? Did all these lockdowns help in controlling the pandemic and flattening the curve? So here I am trying to answer these. And you know what? All of these questions have one common thread which we are going to talk about today. Everything. Everything depends on this one thing. I'm Meghnad, and in this video, let's talk about that one thing: testing.
You cannot fight a fire blindfolded, and we cannot stop this pandemic if we don't know who is infected. We have a simple message for all countries: test, test, test.
That was Dr. Tedros from the World Health Organization. And he's right. You cannot fight a fire blindfolded. A firefighter must know perfectly well where to direct the water stream in order to stop the blaze. In India, the first lockdown was imposed on March 25th. As of recording this, it's been 66 days since that happened. And it is important for us to look at the status of the cases in the country back then compared to today. Now I'm going to throw a lot of data at you, so brace yourself. As of March 24th, we had 567 confirmed cases. This number as of June 2nd is at 207,186. That's a straight up increase of 36,540%. Similarly, the deaths back then were just 9 persons. The number rose to 5,830. That's an increase of 64,777%. But the most important thing for us to look at is the increase in number of tests conducted. As of March 24th, India had reportedly conducted 22,694 tests. That number as of June 2nd was at 39,66,075. That's an increase of 17,476%. If you put these crazy percentages on a chart, this is what it looks like. Look at it again. Compared to the percentage increase in deaths and positive cases, the increase in number of tests conducted has been comparatively much less. The obvious conclusion from this would be, why aren't we testing more? The answer is a little complicated because you have to understand that the number of cases will increase the more we test. But that is only if no other measures are taken, like a lockdown. And it's fine if we test more. As I said before, the idea is to test, and figure out how to deal with this problem as soon as possible. The entire purpose of the lockdown was to keep people away from each other so that the case numbers do not rise exponentially and it flattens the curve. But instead of testing more, our government, both center and state, have actively resisted allowing mass testing. In fact, they have been changing the testing criteria through this period multiple times. That's right. If you do not know anyone who tested positive, you should know that it's really difficult to get tested right now. It's not like you can just walk into a hospital and get it done. You will need to fill up some paperwork, get a doctor's prescription, and only if you fit a certain criteria can you get the test done. Let me give you a simple analogy to make it easier for you to understand. Imagine two ponds, pond A and pond B. Now, pond B has more fish than pond A. If you use a fishing rod and try to catch fish from pond A, there's a chance it will take you a day to get one. But if you put your hook in pond B, you might get more fish because, hey, there are just more fish in it. Pond A for India is full of patients who fit the criteria for testing. Just take a look at what Love Agrawal, the Joint Secretary of Health and Family Welfare Ministry, said.
We do not want to come to a situation where we just test a person because he needs to be tested. See, it is very important to understand that unless until we follow these protocols, we'll end up unnecessarily creating panic. And that is why people who need to be tested, they have to be tested.
So here's how the criteria has changed over time. We start on March 9th. This was 3 weeks before the lockdown was imposed. Back then, tests were allowed for only those with history of travel to COVID-19 affected countries within the last 14 days and those who developed respiratory symptoms within 14 days of home quarantine. On March 17th, the criteria was changed to include all the previously asymptomatic travelers who have developed symptoms, fever, cough, difficulty breathing. That is while they were in home quarantine for 14 days. This is also when some amount of contact tracing started, meaning those people who came in contact with positive patients within 14 days were also allowed to get tests done. The list now also added healthcare workers, but the workers must be symptomatic and exhibit severe acute respiratory illnesses in order to get tested. Just 3 days later, on March 20th, another category of people were added. All hospitalized patients with severe acute respiratory illness and high risk contacts of the confirmed cases were to be tested. High risk meaning those who have had a history of heart ailments, diabetes, etc. On April 9th, hotspots were added. That is, people who were a part of large migration gatherings. The trigger for this was the discovery of the Nizamuddin Markaz gathering. The government later gave a statement saying 4,291 cases in 23 states and union territories were linked to this. Then we finally come to 18th May. Now the criteria was changed to include patients of severe acute respiratory infection, SARI, and those who displayed influenza-like illness, ILI. The government said all symptomatic ILI patients, which were among returnees and migrants to various states within 7 days of illness, were also to be tested. So from March 9th till date, the testing criteria has been changed 5 times to include more and more types of patients. Interestingly enough, there have been 2 major spikes we noticed in testing rates while doing our analysis. One was during the week starting April 1st, where we saw an increase of 71.8%, and the other was in the week starting April 29th, where we saw a spike of 46.5%. But since May 5th, the increase has only been between 10 to 16%. So to answer the question of whether the lockdown has been successful, the answer is a big no. I'm going to show you a chart which proves this. Take a look. The gray bars are the percentage increase in tests done. The red line represents the increase in positive cases and the blue one indicates increase in deaths. You will see that the positive cases and the death spike is exactly coinciding with the increase in tests. But after May 6th, you see a decline in the number of tests done, but the case increase rate remains steady, and more worryingly, the death rate is increasing. This essentially means that all throughout the month of May, we have been testing less people on a week-on-week basis, but the positive cases and deaths are just rising. So yes, the pandemic has not been brought under control despite the multiple lockdowns. And what's worse, we are about to lift the lockdown, and from the looks of it, it's going to get worse.